It's great to be here today. And the next session and the panel are going to be talking about how do we take these concepts of everyone included, particularly when it comes to including patients in decision making, and apply it in ways that maybe we haven't thought about. And one of those areas is cancer care. So I'm going to be talking to you about three things today. How do cancer patients pick the hospitals at which they receive care? What tools are available to help them make those decisions, and how can we involve patients in actually creating tools that answer questions they want answered, so not something that is forced on them by somebody who thinks they know everything. It's no surprise. How many here have heard of the cancer moonshot? Most people in this room. So the cancer moonshot is a really great exercise that is looking to devote $1 billion at minimum to finding cures for cancer. What does that mean? Well, that means spending money last year and this year on cancer-related research and increasing research investments from the DoD and the VA. But what's missing from the cancer moonshot? Well, how about patients today who have cancer and who are trying to make decisions about where they should receive their care? You don't really see them mentioned in the cancer moonshot in terms of how do you make a decision today about where to seek care. It's wonderful if there's a cure tomorrow. But what should I do now if I've just received a cancer diagnosis? How do I make that decision about my care? So we really were thinking about this in terms of how do patients make their decisions. And we know some background information. So for example, we know from this article that Peter Bach and his team wrote that it actually does make a huge difference where you go to get cancer surgery if in fact you need surgery. We know that at hospitals that perform a lot of cancer surgery, you actually have a better chance of surviving over the long run than you do if you go to a hospital that performs fewer of those surgeries. We also know something else. We know that the type of hospital you go to also makes a huge difference. That if you go to a cancer center like an MD Anderson or Sloan Kettering, that your chances of living 5 years with that cancer are a lot higher than if you go to a community medical center. Now, there's going to be variation within those groups, but there's a huge difference when it comes to the type of hospital at which you seek your care. So you'd think, given this information, we're going to have a ton of information out there to help you make those decisions, right? And instead, this is what we have. Ads. We have ads from cancer centers, and with all apologies to Stanford, I know we're at Stanford, you got to include Stanford in a deck like this. We cancer beat this, right? Nice, clever take with cancer. Another one with MD Anderson, with Sloan Kettering, cancer, nice try, which give you a lot of glowing language, but when it actually comes to giving you their statistics, not so much. Or another clever take on cancer and a local hospital that says that this person had to just go around the block. But is that right? Are the outcomes better at these hospitals than at other hospitals? So I did what probably lots of people do. I turned to the Googles and tried to look up the outcomes at these hospitals. And very few hospitals today put online their outcomes for cancer surgery relative to others. How can that be? Where else do you turn? US News and World Report, which has a huge influence in terms of reputation on the rankings. They do try to take into account an increasing amount of quality information, but it's still very much based on rankings. So we tried to ask the question, can we build a tool for this? ProPublica is known now for building news applications that let people actually try to answer questions that apply to them, their doctors, their hospitals. One is a surgeon scorecard, which my colleague Marshall Allen spoke a couple of years ago here about. Another is a tool we have called Treatment Tracker. And these were tools that we took Medicare data and created public-facing tools. But what we asked ourselves is, could we do this better? Could we create a tool in a different way than we have in the past? And one in collaboration with patients. So we decided to team up with Sloan Kettering and Peter Bach, as well as Inspire and ProPublica, to try to ask patients what it is that they actually would want in a tool. Our objectives were pretty straightforward: how people with cancer choose hospitals for their cancer surgery and help improve how people choose hospitals. But instead of us deciding what people wanted to know, we decided to ask patients, what do you want to know? We heard from 3,334 patients in the US who've had cancer surgery, plus hundreds of caregivers. That's a pretty remarkable number, a robust sample, something that a lot of people who are designing tools for patients don't ever bother to ask the question. We hadn't bothered to ask that question before. And here's what we had. By disease, we had a really nice representation in thyroid cancer, breast cancer, bladder cancer, and ovarian cancer, but other cancers as well. So here's what we learned. We learned that, did you try to find information that compared your hospital with other hospitals before making the decision? 3/4 of people said no. To me, that gave a lot of opportunity to help people make decisions. So how satisfied were folks? Interestingly, even though 3/4 said that they did not compare their hospital to others, about 3/4 said they were very satisfied with the care they received. So they weren't regretting the choice that they made. And here's the information that patients said that they would want. Interestingly, to me at least, reputation was very high. And it's a big question that I think we'll tease out in the panel. What does reputation even mean? And is that measurable, or is that the type of thing that you would talk to friends and family members about, or within your communities, online communities that you could discuss? Relatively fewer people wanted information about complications and whether or not you'd be alive 4 years after surgery. Those are, and I'm interested in discussing that a little bit too. But what we found is that people are very likely to use the tool. That roughly 75% of people said they're at least somewhat or very likely to use a tool to help them make decisions. So we were not sort of going down a blind alley. And we think there's immense opportunity to help empower patients with information we know could actually mean the difference between life and death by helping them pick a cancer hospital better. And so that's what we're going to be talking about on the panel, and I think we're going to bring up the panelists now.